Hello, can everybody hear me?
Yes, Rahil bhai, we can hear you loud and clear. Basically,
Okay.
others might. Yep.
Okay, sure. Welcome everyone. Sorry for the delay. We'll just keep it informal and we have a bunch of slides. We'll go through it together and we'll just admit as people come by. Okay, Aman?
Okay, I'm gonna start it right now. Share screen. Okay.
Okay, so first of all, thank you so much for joining. And the topic of this meeting is how to gauge interview questions in a way that you can tell your story. At the end of the day, it is all about telling your story. You have done your exams, you have done your US legal experience, and you have done everything you could. And now it's a time to just make sure that you comprehensively paint that picture. So I always name it telling your tale. This is the last mile. At the end of a marathon, it's the last sprint. Next slide, please.
Yep.
So yeah, I am a resident at Carl Foundation Hospital. I'm in my intern year, currently in my adult medicine rotation, and we'll go on because this meeting is, a free meeting, 40 minutes, so I'll not waste introducing myself. So let's go on.
Okay.
This is a little bit about my journey, but we can skip that for later. Let's just jump right to the topic. So I think the most of the IMGs struggle with this idea that they believe they come from an under resourced and under training wise, if they feel like they're deficient, and sometimes that can show in your interview. So to avoid that, it is important to tell yourself that you can do it, you are worth it. If a program has chosen you for an interview, it means you deserve it and you have all the required um, you know, um, prerequisites to be there. So never sell yourself short. And I say this because until and unless you believe in this philosophy, you cannot say things and then it just shows this discrepancy. You're saying something, but you are faking it. So it is very important that in the back of your mind, you believe that what you are saying is true. All the strengths, all the weaknesses, all the things that you are saying is not made up. It is true. So first thing, you believe in it. And yeah, you can go next.
Sorry.
This is actually a slide from my, I delivered at a lecture at my medical school, so we can skip this one. This doesn't go
Okay.
through. Yeah. So I know you are past your CV, personal statement, and LOR stuff, and I wish we have done this sooner. But just to give you an idea about how to document things, I mean, you have documented it already, but then now that in the interview you have to say those things. So I'm giving you two examples. This is an example of a blood donor society that we have in our hospital. The first two lines are about a very ordinary introduction about your volunteer. And the second paragraph is about how you can improve it. So first person is saying, I was a part of Blood Donor Society and we organized blood donation camps in our medical school. Good. So that a good and better way to say it is, I coordinated with the hospital blood bank to perform free blood typing and screening of 300 volunteer medical students. Small introduction of what's happening. It is quantified, 300 volunteer medical students. It is specific, perform free blood typing. Gives an idea to the listener what's actually happening. Then what did you do? Distributed blood donor cards after registering the biodata of volunteers. Worked with the infectious disease department of the hospital to help 40 students with negative serology to get a booster dose. 9 medical students positive for Hep B and C were guided for further investigation and treatment. Okay, connected appropriate donors. Now this is a CV format. I'm not saying you have to say it like this, just to give an idea how to be more detailed. Connected appropriate donors with thalassaemic patients registered with hospital blood bank, promoted the slogan, gathered valuable experience. So in the last line, it is saying gathered valuable experience in terms of blood safety, pre-donation and post-donation requirements, and prerequisites of conducting a blood donation camp. So what I'm trying to say is you have to shine in your interview. You have to be more specific in your interview so that it gives the listener an idea that one, you're not faking it. Secondly, you actually did something and you did it in the true sense, and hence you are able to vocalize it so good. Most of the times when we are just saying something because we need a filler for our speech, then it reflects in the speech because you're not specific about it. You don't share the background of the story. So one of the techniques of doing this is to use this mnemonic. Like you have to first use what is the event that is happening, and what is your role in it. Secondly, you have to tell three things about it, at least three things. When you say three things about anything, it sticks to memory. When you just say one thing, or if you say 10 things about it, it doesn't stick to memory because it is too long. If you say one thing, it is too small, it doesn't stick to memory. So always use three things. I am hardworking. Give three examples. I worked a night shift. I passed my boards, in difficult circumstances. Or thirdly, I organized a camp for someone. So whatever, three things. Always use three things to strengthen your whatever you're trying to portray. Okay, next. Does it make any sense? I just don't want to rush things without any clarification. If anyone of you wants to stop, you can always unmute and talk about it. I'll just let Ahmed be the judge. Think it's understandable?
Yeah, it is very understandable right now, Bhai.
Okay, all right, thanks. So again, documenting things wise, we have a house job here, and one way to say is this. And sometimes people sell short. They're like, we only did house job. We didn't do like so much clinical or research work in our, in our CV, or we didn't do like, nephrology research at Mayo Clinic. So we don't have anything to shine. That's not true. You have done your house job. I mean, even if you have done any like sort of a medical work in your home country, you can always portray it in a way that it looks, substantial. So I'm just giving you an example for that. The first ordinary way of saying this is I did 12 months of house job in general medicine and allied department and general surgery and allied department. Now, the second way of saying this is, now this is for the CV, I know, but you can take some points for the interview too. Evaluated 40 to 60 patients daily in the Department of Internal Medicine, Dermatology, Neurology, Endocrinology, and all those allied fields. Presented 5 to 6 patients daily on their morning rounds, actively participated in discussions on the management of CHF, CKD, CVA, PPD poisoning, snakebite poisoning. Performed diagnostic and therapeutic procedures of blood sampling, urinary catheterization, nasogastric intubation, electrocardiograms, paracentesis, or acocentesis. Sent referrals for opinions to, or you can say consulted radiology, neurology, surgery, all those fields. Consults are important, and you have to tell them that you did it. Acquired skills of teamwork and critical decision-making in diverse setting of 1,800 bedded tertiary care hospital. So this is our hospital. Everybody has a different way of saying this too. This is just an example, like whenever you're talking about some experience, so as to make in those three things, you can always talk about some interesting case that you saw. And yeah, these are just some examples. So yeah, next. Okay. Now this is important. This is especially important for the interviews. So there are ACGME core competencies, which are medical care, the first one on the left side, then medical knowledge, then practice-based learning, then communication skills and interpersonal skills, professionalism, and system-based practice. Some interviews are very specific and they're very organized in that their questions are in a way that they judge you on these capabilities. And sometimes they have these forms that they fill out in terms of, based on your answers, what do they reflect in terms of your patient care, in terms of your professionalism? Like when they throw in a question about a difficult patient or a patient who is not listening to you, what are they checking? They're checking your interpersonal communication skills. When they're asking you about a diabetic patient in a clinic with 400 blood sugar, they're checking your medical knowledge. Then they ask you about patient advocacy. Like, for example, a patient is poor and he cannot afford something. How would you gauge that situation? That is your, patient care. And then for your professionalism, any, your colleague is drunk or was drunk last night and is under influence during the duty hours, what would you do? That is your professionalism. Then system-based practice. You made a mistake, how would you handle it? So you must know about the system. Who do you go to? What's the hierarchy of the system? Who do you report firstly? You go to the chief resident, then you go to the you actually go to the class representative, then you go to the chief resident, then you go to the AP, then you go to the PD, then probably an ethical committee. So there is a whole hierarchy. That's a system. Similarly, on Epic, nobody has asked anything about Epic though, but these were some crude examples. Does that make sense?
Yep.
Yes.
Okay, so this is something to keep in mind whenever you will be answering the question. Make sure that your answer is formed. And I know, I had this problem. I always used to be truthful and, saying just as things went by. Unfortunately, the real world doesn't like it. So you have to sort of portray your answer in a way that fits and gives you a good check score number on these core competencies, because you will be evaluated with these core competencies throughout your 3 years of training. So yeah, so other thing that I've written on this slide is you can also read a description of what actually these all of these competencies mean. Patient-centered care, value-based medicine, quadruple aim. So these are just some general tips. One of my mentors in New York, Dr. Rizanullah Hamid, told me, I'll always be grateful for him. 3 things you should always learn, very important in US healthcare system, very important in internal medicine. PDs love to talk about it. They really like it if interviewer knows these things. So one is patient-centered care. Looks simple, but if you Google it, you'll find a definition. Okay, patient-centered care. I don't want to go into the details, but it means that patient is the decision maker. You tell everything to the patient comes up with a plan, and then you follow the plan. He wants a certain drug, you tell him the risks and benefits, he chooses a drug. He's poor, we find a drug. That's called patient-centered care. Instead of me deciding, okay, I'll give you this medicine, we'll follow up with this thing. No, I have to hear him. I have to tailor my treatment plan to his needs, his wishes, and whatever suits him the best. That is the patient-centered care. And you will learn more if you read more about it. So actually, this was my interview question. Someone asked me, what is patient-centered care? Then an important thing to know is value-based medicine. Talk across our town, people are talking about it, especially New York programs. They are inclining towards finding a solution towards poor US health outcomes, despite investing so much dollars into the healthcare, yet patient dissatisfaction and poor outcomes. Hence, value-based medicine is an important term. You should all be familiar with it. Third is quadruple aim. Quadruple aim is also a term that involves patient satisfaction, provider satisfaction, value-based medicine, and I think patient-centered care. So these are the terms that you can always use. These are the terms to familiarize to know the US healthcare system. Someone in your interview will always ask you, how do you compare yourself? How do you compare US healthcare system with your home country healthcare system? How do you, how was your US clinical experience? So once you read more about it, you will find something in your clinical experience that resonates with this core concept, and then you can connect and then tell it in your interview. Then medical scenarios. Yeah, so sometimes some programs do ask about medical scenarios. In my experience, mostly were simple, like pulmonary embolism patient came, like long flight, patient came with tachycardia and chest pain. How would you proceed? You have to know the steps of it. Okay, it's not an exam question. They're not trying to know, oh, we just thrombolize the patient. No, they don't want to do this. They want to know your thought process, and your thought process should be like, I will talk to the patient. I'll see the first thing you do, you make sure the vitals are stable. You do a primary survey. Everything looks good. You document that, and then you do an ECG, the baseline things. You do a well score, obviously. You skip the well score. You do a CT angiogram. CT angiogram finds it. You start the patient on. Then you consult IR for thrombolysis. Then they will ask you, like, how would you consult IR? So then you tell them that, I'll tell them that this is my case and this person, they need thrombolysis, and make sure there are no contraindications to it. And then, so that's it. So that's your thought process that they want to know, the stepwise approach towards diagnosing something, ruling out other things, making sure that the best treatment possible, no contraindications of that treatment, consulting the appropriate subspecialty, and then following up on the intervention. So that's how you should gauge your medical scenarios. Similarly, in outpatient with blood sugar is 400, they want to know how you will ask. You will obviously start with interviewing the patient. You make sure that they are not in DEEC. Obviously, if it's a clinical setting, the approach is different. If it is an inpatient setting, the approach is different. And if it is an emergency setting, the approach is different. So always categorize where the patient is right now. With the clinic, you will talk to them, you will see their, eating habits, insulin regime, change it accordingly. You can read up on that. But what I'm trying to say is they want to know your thought process and not the best. It's not a multiple choice question that, you have to click something. Second thing is in comparison between Pakistan and healthcare that they may ask you about your experience. If you have an experience in your home country, they will always ask you to compare. So a good point is to remember those patient-centered care, value-based, quadruple aim, read more about it, use your US clinical experience to find examples for it, and then compare it with your home country experience, and then come up with a comparison. Secondly, non-verbal cues doesn't encounter. I think it's just like, that you're there, just smile. Non-verbal cues are like, so it used to be more popular when people used to go for in-person interviews, but in Zoom, you can, always fake things. But yeah, just basic things, you have to be cordial, you look pleasant, and listen, be attentive to what they're saying. Ethics, behavior, yeah, 2 points, don't do anything stupid. Comparison between Pakistan and US growth, I think we're done. All right, next. Also, in the comparison part, you should also convey hope. Like, don't always say negatives about your country. That shows that you're a negative person who only looks towards the bad aspect of things. So make sure that, whatever you're saying is a diplomatic way, good of both sides, shows areas of improvement, but doesn't tell that's so bad or that is an overkill. So always have a balanced approach towards comparison. Okay, next is, so yeah, this is just I think extension of what I told you before. Those were core competencies. This is milestone. This is what residents are evaluated during their training. I'm telling you all this because that's what they will also check in your interviews. And they will ask you a medical scenario or some difficult patient scenario. That's what they want to know, and they will grade you for it. So each resident is graded from level 1, which is basic individual, to level 5, complex, specialized, or leadership roles. So yeah, basic level 1 is like someone is, just basic medical knowledge and making sure nobody dies. Level 5 is complicated medical knowledge, coming up with plans for complicated patients. This is something that third-year residents do, leadership roles and specialized healthcare. Then an example is, sorry, not the example, the core competencies that have those milestones are patient care, which involves history, physical exam, clinical reasoning, patient management, digital health, EHR, and telehealth. So electronic health records are an important thing. Telehealth is an important thing these days. Telephonic conversations we have in our clinics. So if you have done something like that, always mention it. And then medical knowledge, applied foundational science, therapeutic knowledge, diagnostic. I'm sure you guys are all wonderful on that. System-based practice, knowing the system. And I understand, most of us don't have a lot of US clinical experience, but whatever you have, make sure you know it thoroughly. Systems, as I told you about the hierarchy, how you report a complaint, how you, what is patient advocacy, what are the core values of the system, patient-centered care, quadruple aim, all those things. And then if you find any other examples, make sure you know, as more you know, the more better you are able to form your answers. Then patient safety is another important aspect, avoiding preventable errors, name tagging, monitoring technology. Yeah, quality improvement is also an important thing. Yeah. All right, I think this is more CV oriented. I don't think it's interview oriented, so we can go on. Okay, so the things that are highlighted in different colors are the ones that they can ask in your interviews. Patient-centered care was something that was asked from me. Of someone asked me an example for patient advocacy, and this is a new term for me. But then, what advocacy means if a patient is not able to advocate for themselves, they don't know their rights, they don't know what resources they can avail in the system. You jump in, you advocate for them, you fight for their cause with the system, with resources, and you make sure your patient gets better despite whatever superficial constraints are there. One example that I use during, so I was not in US, but because US we cannot advocate, right? And IMGs, especially old IMGs like me, or we don't have like rights to electives and all those fancy rotations. So we do observerships, and you cannot touch a patient on that. So I use an example from my country where a patient could not afford a remdesivir injection, and then we consulted we formed a team, um, and then we consulted the charity fund for it. We organized money for that patient. We made sure he got remdesivir. So that is an example of advocacy. You can always find examples like that. I'm sure everybody has done some form of advocacy in their medical career. So then evidence-based medicine, another important term in US healthcare system. Everything has to be backed by a trial, by data. Nothing has to be whimsical or, my senior used to do it, so I am doing it. That doesn't work this way. So you have to have evidence for it. Give examples for it. If you see something like that in US, have you seen it? So this is also an important point to bring up when they ask you about what was your US clinical experience, or how would you compare your US experience with your home country experience. So yeah, and then the third thing is stressful situations. So stressful situations is something that I always struggled with, because if I really tell them things that I was stressed about, they would not hire me, because I am a very stressed out person. So I think in that scenario also you have to be a little balanced in your truthfulness. And I'm not saying lie or something, but then, and this is human life, we have to be emotionally intelligent about certain scenarios, and that's what they want to see. Nobody's perfect, and that's okay. But how you suppress certain emotions and put to work your emotional intelligence, is that what they want to see? Now, when you put an example, make sure it is not haphazard. You have a format in your mind. Therefore, write things down, write these important questions so that when you are saying this, you don't have to so many gaps. No, doesn't look good. So one example that I would say is, now not every, no, if I'm saying this here, I don't want everybody to use this example, then it would be just a sham. So like a stressful situation could be like, when I was working in my, so you have to give a background of the event. See how I do this. Um, I can remember so many stressful situations in my medical career. And one thing that is coming to my mind right now is, it was a busy night. During my night rotation, I was working on the COVID floor, and I was the in charge physician, and we had almost 40 admissions. This was the first COVID surge in Pakistan. During this hectic night, it was a stressful situation. Now I'm telling about it was stressful. I kept my nerves under control. I assembled a team. I encouraged the nurses, the physician assistants, the phlebotomists, and and another doctor, the junior doctor who was present with me, and we discussed how are we going to get through this night. So we assigned roles. One person was responsible for making sure that we have extra beds available. One person was ensuring the appropriate medication, making sure the supplies are adequate. One person contacted our attending on call and informed that about the busy night, making sure that we have extra oxygen cylinders in the hospital and extra beds were arranged. With this teamwork and dedication, we got through this night. What I learned from this is that no matter how stressful a situation is, if you are able to harness the power of teamwork, anything is possible. So That was my answer. And there was something, but I think I don't remember all of it. So firstly, background of the scene, what you did, the body of your answer, and lastly, what you learned from it. So make sure that your answers are portrayed in a way that convey a meaning. They're not too long, they're not too short. They convey what they're looking for. Now, teamwork is a basic attribute that every program would want in their residents. So always make sure that what they're looking for, and then and this is a true thing. I didn't make it up, but in the situation, I was not thinking, I am going to do this because of teamwork, but it just happens using the words that are most likely that they want to hear, and or for all the right reasons. So I hope I am clear on this. Any
Yeah.
questions about that? Okay.
If anybody has a question, you can, when the speaker asks for it, you can unmute your mic and you can ask the question.
Yes, I have a question, if you can.
Yeah, sure.
Thank you so much, Dr. Muhammad, for this. I just wanted to ask, what would you recommend us or advise us to do if we were faced with an unexpected question? Like it took us off guard. How do you think we should act or like respond to it?
Yeah, it's a great question. This can happen, it will happen. So that's where I was trying to teach those core competencies of patient care, medical knowledge, professionalism, interpersonal things, evidence-based medicine, quadruple aim, patient-centered care. When you know about these things and you are trying to give an answer, and the interviewer will always be looking for something in those grounds. So whatever is coming to your mind, make sure you connect it with these core values. And hopefully you will come up with an answer that they want to hear. Like, don't go off track. They may want to distract you, but always come back to this circling thing: patient care, evidence-based medicine, value-based medicine, and increasing health outcomes, patient satisfaction, doctor-patient relationship, patient safety, all those things. These are the terms that they want to know. So always, and I'm sure everybody has different experiences, and they can always link them to these core terms. Does that make any sense?
Yes, it does. Thank you so much.
Yeah. So for these reasons, you must read on these terms so that, and when you're writing your answers on a paper, make sure that your answers have some component of these basic things that they want to hear.
Got it.
Okay. All right. Thanks. Good question. So the next thing is ethical principles. Yeah, ethical principles, I think basic ethics. This is very basic ethics, like I don't remember all of them, but like beneficence. Actually, someone asked me this interview also, like, what are the basic ethics of a doctor? Like beneficence, non-maleficence. Help me out. What were the other ones?
Autonomy.
Um, Autonomy. Okay, well, just read on it. There are 5, 6, I think.
Equity, I
So,
guess. So.
yeah, I don't know. I think it's there are 4 or 5 things, and they may ask any one of them. Basic ethical principles of our profession. So just read up on it, and that's again another an important point to bear in mind when they're throwing an off-guard question. So autonomy, beneficence, non-maleficence, and justice. Yeah, you're right.
Yeah.
So always they want to know these things. Use examples that convey these principles, and not something that you actually did or something that is. I'm not saying to lie, but then I'm sure people have done things that they can relate to these 4 basic ethical principles. So yeah, so when you say that when I was I was trying to help the patient get remdesivir, what was I trying to do? I was using the basic healthcare ethics of beneficence. When you say it like this, it tells the interviewer that you are aware of these important terminologies, and they get impressed by it. So make sure you use these important basic principles to put them in your answers so that it reflects that you're more sophisticated in your answers. Okay, next slide.
Okay.
Okay, common questions. Tell me about yourself. Icebreaker question. So yeah, everybody will ask this. Always be, energetic about it. Sure, doctor. I would love to say it. Use adjectives that are, that convey passion and not just, don't slack. You have worked so hard for it. So make sure you shine on your first answer. Sure, doctor. I would love to talk about myself. Firstly, thank you for this opportunity. My name is this. I'm originally from this. Tell a bit about your home country. My country is one of the historically rich countries of Pakistan. Now, the answer to this question can be divided into two things. One is the personal aspect of your introduction, another is the academic aspect. I always try to do the personal aspect first. Like, I am the youngest in my family. I grew up here, from humble backgrounds or whatever, your life story is. And then you can say that, just give two or three things. I used to say I come from a family of teachers, and I've always grown up listening to stories of Shakespeare and Hamlet, and that gives them an idea, some specific idea of your personal roots. That I have that educational and literary learnings in my family. So yeah, so that is just personal. And then something that you like to do: I love to draw, I love to sketch, I love to play sports in my free time or something like that. So that's personal. And then academically speaking, so now be very concise about it. Because I had like almost 4 years of a gap from my medical school graduation, so I had a lot to say here. So that is why I say it like this. Now, if you're a fresh grad, then you can go to your medical school and then start from there to your end of medical school. But how I said this is like, I graduated in this year. I don't say I took my step one because they know when you took it. Just say after graduation, I worked in a rural health center, and I took care of under-resourced populations there. I organized a dengue camp. I was working during the COVID-19 time, making sure that we screen appropriate individuals and contact trace the people. Then I did 1 year of residency in Pakistan in internal medicine, and then just the basic things like 1 year of internal medicine. Like, for example, in the last line, I say 1 year of IM residency, 1 year of US clinical experience in the states of, just be specific, in the states of Texas, New York, um, Illinois, Florida. That's what I used to say. I have five, I did research. Don't say I have two publications. Say I did research on SGLT2 inhibitors and diabetes mellitus and its effects on diabetic ketoacidosis, so that they know that you did something. And then I was also a part of the largest healthcare population health management project, which is a Mount Sinai district project. I've also worked in a long-term healthcare, in a Fox long-term acute care setting, and I've been a part of several QI projects. So that gives you everything of that. Sometimes they may not go to your US clinical experience. These are the things I really wanted to share in my interview because I worked hard for it and I wanted them to know this. Sometimes they ask you these questions that they have in mind, and they wouldn't even go towards the questions that you want to share. So make sure that when they're asking you some open-ended question, you put those things in those answers so that they actually know. Don't be too
And
long, but sorry.
Dr.
Yeah.
Rahil, Dr. Rahil, sorry to cut in. So we have like 5 minutes and 20 seconds remaining for the session.
Okay, how many slides are there?
Let's see, 1, 2, 3, 4, 5, 6. 6 slides.
Oh, so yeah, I think we have a lot of slides left. So yeah, I think that's conclusion. Then we can move on to the next slide.
Okay.
The strengths, you can always feel free to take a snippet of these things, and the strengths that they're looking for is leadership. Find an example. Like I said, COVID-19, I organized a team, I led the team. Use those words because that's what they're looking for. Team players, stress scopers, stressful situations, personal wellness. I love to play guitar also, and you can use it in your stressful situation. In these challenging times, I love to play guitar when I go home, or I love to sketch because I can, de-stress myself. Adaptable. I worked in multiple settings in US healthcare system in different states. I worked in inpatient, outpatient. I've worked in volunteer groups in Pakistan. I worked in tertiary cares, primary care, secondary care. I worked in, mobile health clinics. So that shows that you're adaptable. Scholarly activities, show your researches, show your posters, whatever you have done, and all those things. Then reliability. Tell them an example where you came up with. If they ask you something, they want to know that you are reliable, that you are not someone who would just mm, make always find negative in things, and they can rely on you. Good learner, always with an example. So with examples, I mean US clinical experience, not something that irrelevant, like always use US clinical experience. Use open-ended, maneuver the question how you want. Yeah. Then weaknesses, benign weakness. Don't show like, I'm so anxious, I cry myself tonight. So just use benign weaknesses like time management. We all have that. Public speaking, difficulty saying no. I'm very empathetic. And you can always say that, my weaknesses are linked to my strength because I'm very sympathetic. That also translates into more patient care. But sometimes it can take an emotional toll on you, and you get, sometimes it's difficult to balance things or something like that. I don't think that's a good example, but yeah, somewhat like that. Long-term plans, future goals. Yeah, always say in the goals, they will ask you what are your future goals. Always tell them your short-term goals, long-term goals. Short-term goals is finishing IM residency, settling in, starting a family, pursuing your goals. Like, I want to pursue my hobby of performing arts also. And then long term, I am open-ended. So I used to say I'm very flexible, and I don't have a fixed specialty right now, but I'm more inclined towards geriatric medicine or let's say addiction medicine or whatever. But I'll keep my options open for now. I'll see how the residency goes by and what area interests me more, and then Ahmed, can we go next?
Yeah, sure.
Why USA? Again, the basic things: patient-centered care, evidence-based medicine, research-driven learning environment, those core concepts. Comparison, I think I've talked more about it. You can always use different things. All right, yeah, US clinical experience, again, use these basic terms: evidence-based medicine, patient-centered care, research-driven learning environment. Okay, next is stress behavior ethics. This is the example I gave you. One incident, I
Yeah.
was working in busy ER, lots of admissions, formed a team, assigned roles, challenges, teamwork, learned this. That's how you have to portray it. Difficult colleague. Yeah, that's also a question they ask you. So you can always say that I have to balance my relationship with my colleague without compromising patient care. That's the key word there. You have to say, for example, a colleague was coming late at nights or leaving early. Now, what do? You don't report him to a chief resident. You talk to the person first, see what's going on. Maybe he has an exam coming up. So I pitched in. I said, I'll help you during these days. And then please make sure that you inform us. When you don't inform us, we don't know. So I'll pitch in. I will fill in your extra duty hours, and then you can get done with your exam. So what did you do? You did not compromise patient care because you yourself helped him, and you also did not destroy your relationship with your colleague. So you have to balance these two things. In any example you choose, just remember they want to see this balance. Difficult patient. So there are two types of difficult patients. One is a diagnostically difficult. I would say don't choose that. Choose a behaviorally difficult patient, someone who's not complying to your suggestions, who's saying, I don't want this drug. Now, what do? You have to explain him the risks and benefits of the drug. You have to give him the opportunity to tell you why he's refusing that drug. So that, and once he knows this, mostly they understand. And patients, unless one or two are like really stubborn, they usually, when you give them a lot of information and education, they comply. So that's where you have to be more communicative. That's what they want to know. Then